Supporting Students with Disruptive Behavior Disorders presentation by Marie Pellegrini for facilitator Nicole Celsi for advancement courses, July 28, 2020. According to Nationwide Children's Hospital 2020, they state disruptive behavior disorders, DBD, can seriously impact a child's daily life. Children with disruptive behavior disorder show ongoing patterns of uncooperative and defiant behavior. Their responses to authority figures range from indifference to hostility. Their behavior frequently impacts those around them, including teachers, peers, and family members. Symptoms of disturbing behavioral disorders can be severe and persistent anger, defiance of adults and authority figures, lying, and other antisocial behaviors. Conduct disorder symptoms tend to be more severe and intense than symptoms of ODD. ODD stands for Oppositional Defiant Disorder. What causes ODD? There are several possible causes for ODD, combination of biological, psychological, and social factors. Family history of ADHD, substance abuse, mood disorders, lack of structure and supervision within the home environment, inconsistent discipline, residing in an unsafe or violent community, or exposure to abuse. While there is no treatment for all children and adolescents with ODD, the most effective treatment plan will be individualized to the needs of each child and family interventions in the form of parent management training. The following are helpful suggestions for working with children with ODD. Avoid power struggles, be consistent, give student choices, give students space to reset, offer other positive reinforcement and appropriate rewards, make personal connections, and provide problem-solving skills. CD stands for conduct disorder. According to Katie Morton in her video, conduct disorder violates the rights of others. Their perception of others is overblown. Students are usually diagnosed at 10 years old. What causes CD? Some possible causes of CD could be mental illness, sexual abuse. A child could never be soothed when they were young. Parents may have been alcoholics or schizophrenic. And lastly, there could be an injury to the brain. Possible treatments of conduct disorder. Cognitive behavioral therapy, CBT, is a short-term, goal-oriented psychotherapy treatment that takes a hands-on, practical approach to problem solving. Its goal is to change patterns of thinking or behavior that are behind people's difficulties and so change the way they feel. Martin, 2019. Parent training, anger management training, IEPs and 504s with modifications and accommodations, and lastly, antidepressant and/or antipsychotic prescriptions, which are prescribed by a medical doctor. ADHD, Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder. Despite multiple studies, researchers have yet to determine the exact causes of ADHD. Scientists have discovered a strong genetic link since ADHD can run in families. Other factors in the environment may increase the likelihood of having ADHD or exposure to lead or pesticides in early childhood, premature birth or low birth weight, and brain injury, according to the American Academy of Pediatrics in 2019. The American Academy of Pediatrics in 2019 state that the symptoms of ADHD can be excessive motor activity during toddler years, inattentiveness and active behavior, struggles to follow through with instructions, children lose things they can be easily distracted, they talk excessively, they have difficulty waiting or taking turns, and they interrupt or intrude on others, and they may also have difficulty engaging in activities quietly. Section 300 of the Individuals with Disability Education Act, IDEA, is to maximize extent appropriate children with disabilities, including children in private or public institutions or other care facilities, are educated with children who are non-disabled, and special classes, separate schooling, or other removal of children with disabilities from the regular educational environment occurs only if the nature or severity of the disability is such that education in regular classes with the use of supplementary aids and services cannot be achieved satisfactorily. Several models used to assist students are a co-teaching model where two teachers are in a room working with students in a small group, whole group, or offering individual assistance to students. Push-in support is when a teacher comes in to support students to work for a class or two. There is also pull-out support when a student is taken from the classroom for part-time and receives instruction in another room or area for a portion of the day. And then finally, there's the self-contained room. RTI stands for Response to Intervention, which is a system that helps students from falling through the cracks in school. A part of school-based treatment plan for behavior, academic support, and a special education resource team. Developing anger management and relation strategies with a social worker. Clear behavioral expectations school-wide, and administration of medicine by a school nurse. When we deconstruct the function or the why of one's behavior, we are better equipped to respond to the behavior in positive and empathetic ways. Identifying the purpose or function of a student's behavior, develop and implement a plan to modify variables that maintain the problem, teach appropriate replacement behaviors using positive interventions. In general, the common purpose of problem behaviors falls into two main categories: to get something, whether it is attention or a reaction, or to avoid something like a task or a situation. To support students with disruptive behavior disorders, try to support them using evidence-based classroom methods to promote positive behavior. One such way is to promote positivity through prevention. Be aware of potential triggers that will result in disruptive behavior and stop the behavior before it starts. Another way to support students with disruptive behavior disorders using evidence-based classroom methods to promote positive behavior like PBIS, the Positive Behavioral Framework. PBIS encourages positive behaviors while preventing problem behaviors. Discipline, not punishment, is the key to success for students with DBD. Students need explicit instruction and support in positive behaviors. PBIS is a 3-tiered evidence-based framework for improving and integrating all of the data, systems, and practices affecting student outcomes every day. Another evidence-based classroom method to promote positive behavior is to be sure routines and procedures are in place. Classroom procedures and routines should be taught, modeled, and practiced just like academic content. Use positive peer models for students to see how routines and procedures are performed. A third way to support students with disruptive behavior disorders using evidence-based classroom methods to promote positive behavior is to utilize behavior-specific praise. This should include a description of desired behavior. It should be specific to a student or the class and include a positive praise statement. An example of behavior-specific praise statement could be, "Great job taking turns during group discussions class." So the desired behavior is taking turns. I am referring to class, and the praise statement is "Great job." Using evidence-based classroom methods to promote positive behavior is to use opportunities to respond. Students feel more successful and confident when they have share time. Students with DBD seem to prefer tactile or hands-on learning opportunities, as well as opportunities that involve the use of technology. Activities and academic content should be appropriate level to avoid boredom and/or frustration. Another evidence-based classroom methods to promote positive behavior is to use the zone of regulations. The curriculum also helps children better understand their emotions, sensory needs, and thinking patterns. They learn different strategies to help them cope and manage their emotions based on which color zone they're actually in. Additionally, the zones of regulation help kids recognize their own triggers, learn to read facial expressions, develop problem-solving skills, and become more attuned to how their actions affect other people. Kuipers, LM, 2011. Using the zones of regulation consistently provide correction and reteaching of behavioral expectations when children are upset and can be difficult to appropriately communicate their feelings. The green zone is used to describe when you're in a calm state of alertness. The yellow zone describes when you have a heightened sense of alertness. This isn't always a bad thing, and you typically still have some control when you're in the yellow zone. The red zone describes an extremely heightened sense of intense emotions. When a person reaches the red zone, they're no longer about to control their emotions or reactions. Being in the red zone means you're feeling anger, rage, terror, or complete devastation and feel out of control. The blue zone, on the other hand, is used when a person is feeling low, states of alertness or arousal. Getting back to the green zone. Along with being able to identify the zones and know what zone they're in, your child needs to know strategies to help them get back to the green zone. Practicing co-regulation and self-regulation strategies while your child is in the green zone will help them learn the best ways to get back there during times when they're feeling stressed and frustrated and sad. A final support using evidence-based classroom methods to promote positive behavior is to implement checklists with your students. This is a way to prepare and support students to be successful. They understand the rules and the procedures. Decision making is a critical skill. Helping students understand how their decisions and actions impact others is a critical skill in managing emotions and behavior. A simple model like SOTAs can support students in this process. S stands for situation. Describe the situation in detail. Be specific as possible. O stands for options. Think of at least 3 options for handling the situation. Explore multiple options. D stands for disadvantages. Write as many disadvantages to each of the options as possible. A represents advantages. Write as many advantages to each of the options as possible. S stands for solution. Look over the whole process. Decide on the best possible solution. There may be more than one. Use individual behavioral and instructional strategies and interventions to support students with disruptive behaviors who do not respond to established preventative strategies and interventions designed to promote positive behaviors. Promote behavioral responses rather than rely on reactive strategies when disruptive behavior occurs. Students might work on how their behaviors impact themselves and others by practicing calming strategies and mindfulness techniques, role play relevant social and behavior situations, play games to learn and practice valuable social skills like taking turns in sportsmanship, and lastly, address in a safe, confidential setting any other behavioral issues students are facing. Other suggestions for providing skills for promoting positive behavior is to include students in authentic social situations like a lunch bunch meeting. Sometimes students require a behavioral support plan above and beyond what is already provided in the school or classroom. An intervention which has seen success is check in and check out. It is an opportunity to make positive connections with students on a consistent basis. It is a scheduled time in which it's individualized for each student, and it might consist of taking the student's emotional temperature. Behavior charts and contracts can help manage behaviors, but need to be tailored for each student based on the level of their needs, motivations, and interests. Rewards and incentives can be verbal praise, special jobs, sitting with a friend, or sitting in a teacher's chair. Providing a calming space or area for the student is another intervention so that the student can take a break and recharge when they feel overwhelmed. Lastly, visuals are an effective way to prompt and remind students to use techniques to self-regulate. Life learning is about respecting the everyday experiences that enable children to understand and to interact with the world and their culture. Wendy Prisnes, editor, Lifelong Magazine. Professional collaboration, Michelle Guerrero, Melanie Ligori. This slide includes the references for all material included in the slideshow by Marie Pellegrini about disruptive behavior disorders, July 28, 2020.